All right, so get ready because we're diving deep into a case report that really got me thinking about ear issues in cats and the long-term problems they can cause. We're going to be talking about a cholesteatoma. Pretty rare and pretty complex, especially in cats.
Yeah, cholesteatomas, you don't see them every day, that's for sure. They're basically like little cysts that form in the middle ear, and they're filled with this keratin debris, the stuff that makes up our hair and nails. What makes this case particularly interesting is the damage it did to the cat's skull. I mean, we're talking bone lysis here, like serious destruction. And it was all revealed through some really detailed CT and MRI scans.
Yeah, and this is the first time something like this has been published. A case with this much bone lysis in a cat from a cholesteatoma. It's definitely new territory.
Exactly. So let's break down this case. We have a 7-year-old domestic shorthair with a history of ear problems. 4 years before this report, the cat had what they thought was an oral polyp. They removed it through a ventral bulla osteotomy. It's a surgery to get access to the middle ear.
So the cat had already had surgery in that area.
Right. Important context. A few months later, the cat developed bacterial infections, otitis externa and media, both ears. They treated it, and it seemed to clear up at the time. But then a few years later, neurological problems, specifically vestibular signs, ataxia, head tilt, nystagmus, all pointing back to an issue with the ear.
Yeah, those vestibular signs are a pretty clear indication that something's neurologically wrong.
Absolutely. So they wanted to figure out what was going on. They started with an otoscopy. Left ear looked normal, but the right ear had some white tissue blocking the tympanic membrane, obviously a red flag. So they ordered a CT scan.
I'm guessing the CT scan wasn't pretty.
It wasn't. They found a mass in the right tympanic bulla. That's the cavity in the skull that houses parts of the middle ear. Even worse, there was severe bone lysis in the surrounding areas. The thing was aggressive.
So how did they know for sure it was a cholesteatoma?
Videotoscopy, a really detailed view of the ear canal. And what did they find? Pale, friable material. Basically, it crumbled really easily. That combined with everything else, the clinical signs, the imaging, it all pointed to cholesteatoma.
Okay, so they had a diagnosis. But like we said, treatment wasn't easy. Let's talk about how complicated this got.
Yeah, so surgery was out of the question. Too risky because of how much this thing had spread. They started with marbofloxacin. It's an antibiotic that works against a lot of different bacteria, and it gets into bone tissue really well.
And how did the cat respond to that?
At first, it seemed like it was working, but then the cat started refusing to take the medication, like so many cats do.
Classic cat move. If they don't like it, they won't eat it.
Exactly. So they tried a short course of corticosteroids to reduce inflammation and give the cat some relief, but that was just a temporary fix. Then they tried a long-acting injection of methylprednisolone, another type of corticosteroid.
Did that help?
No. Actually, it made things worse. The otitis externa came back, and the vestibular signs got even worse. To make matters worse, a bacterial culture they took at this point grew Staphylococcus felis.
So now they're dealing with antibiotic resistance and a cat that won't take its meds. Sounds like they were running out of options.
Yeah, they were in a tough spot. They switched to palliative care, just trying to manage the symptoms and keep the cat comfortable. They used cefovecin, it's a long-acting antibiotic, and they gave opioids for pain relief. And to see how bad the lesion was getting, they did an MRI.
Makes sense.
Yeah.
An MRI would give them a much clearer picture. What did it show?
Well, it confirmed the cholesteatoma was still growing. It was getting bigger in the ventromedial compartment of the tympanic bulla. They were worried about an abscess forming there. And the MRI showed even more bone lysis, plus something new, otitis interna, meaning the infection was now in the inner ear.
So many complications. What happened next?
Well, with all that information, the MRI findings, the fact that the cat was getting worse, and the really bad prognosis, they decided to euthanize the cat. It was the kindest thing to do to prevent more suffering.
That's so sad, but it sounds like they really did everything they could for this cat. This case really shows just how complicated ear diseases can be in cats and how serious those complications can get.
It really does. It's a wake-up call to pay attention to even minor ear problems because they can turn into something much bigger.
So many questions come to mind, especially about the link between the ear surgery years ago and this cholesteatoma. Definitely something we need to talk about more.
Absolutely. That's the real question, isn't it? We'll dig into that and more after a short break.
So before the break, we were talking about how this poor cat had to be euthanized because of complications from a cholesteatoma. And the researchers really thought there was a connection between the cat's ear problems in the past and this cholesteatoma forming, especially that ventral bulla osteotomy from 4 years earlier. Why did they think that?
Well, the timing is definitely suspicious. I mean, it all happened within 4 years of that surgery. And when you look at the CT scans from just 3 months after the ventral bulla osteotomy, there were already some signs that something wasn't right. There was fluid and soft tissue in the right tympanic bulla, but no contrast enhancement at that point.
So even back then, it seems like things were already starting to go wrong. Can you explain a little more about the connection between the surgery and the cholesteatoma?
Well, the exact cause of cholesteatomas is still kind of a mystery, but chronic inflammation is definitely a big factor, especially in acquired cholesteatomas, which is what this cat most likely had. Inflammation creates the perfect environment for the squamous epithelium to get out of place. That's the tissue that normally lines the ear canal and eardrum, and it can migrate into the middle ear. It forms a sac, and as it sheds keratin debris, the sac just keeps growing and puts pressure on everything around it.
So basically, the surgery could have started that whole inflammatory process that eventually led to the cholesteatoma. That's a little scary considering how common ear surgeries are in cats.
Yeah, it does raise some concerns about how we monitor cats after these procedures. What's really interesting in this case is that the cholesteatoma was silently growing. The cat was fine for almost 3 years after those first signs of otitis.
So by the time they started showing neurological symptoms, it was already really advanced. That's why early detection is so important. If they had caught it sooner, maybe when they saw that fluid on the initial CT scan, things might have been different.
That's the burning question, right? Catching it early is key, but it's not always that simple. Routine imaging after every ear surgery would be pretty expensive and not always practical. But cases like this definitely make you think about how we can do better with follow-up care.
This case also shows how limited we are sometimes in veterinary medicine, especially with these rare and complicated conditions. It's a good reminder that we're always learning and there's still so much we don't know.
Absolutely. This case should definitely lead to more research on the long-term effects of ear surgeries in cats and how they might be connected to cholesteatomas. We need to find better ways to diagnose and treat these difficult cases.
Let's talk about the specific treatments they tried in this case. They started with marbofloxacin and enrofloxacin. They're both antibiotics in the fluoroquinolone class.
Right, fluoroquinolones are good because they work against a lot of different bacteria and they penetrate tissues really well. So they seemed like a good choice for an infection this deep, but there was a problem. There wasn't a licensed enrofloxacin eardrop for cats available in Germany where this happened. So they went with marbofloxacin for systemic administration. It's safer for cats because it doesn't have the same risk of retinal problems that enrofloxacin does.
So they were trying to be as effective as possible, but also keep the cat safe, which is important with fluoroquinolones in cats.
Exactly. Ideally, you want to choose antibiotics based on culture and susceptibility testing, but the initial cultures were negative in this case. So the fact that the cat got better after starting marbofloxacin suggested it was working against whatever bacteria was causing the infection.
But then, as we discussed, the cat decided it didn't want to take pills anymore, which is the classic cat thing. How did they deal with that?
Well, they tried a short course of corticosteroids to try and bring the inflammation down and make the cat feel better, but that was just a Band-Aid. Then they tried a long-acting methylprednisolone injection, and unfortunately that backfired. The otitis externa came back, and the vestibular signs got worse.
Yeah, corticosteroids can be tricky. They help with inflammation, but they also suppress the immune system, so they can sometimes make infections worse.
Exactly. You have to be really careful with them, especially with chronic ear infections. Then later, when the cat relapsed with the otitis externa, they were finally able to grow Staphylococcus felis from a culture.
So they finally knew which bacteria they were dealing with. How did that change the treatment plan?
They switched to cefovecin. It's a long-acting antibiotic that's good for Staphylococcus felis.
Yeah.
They also kept the cat on opioids for pain management because the prognosis was still not good.
And even with all that, the MRI showed that the cholesteatoma was still growing. It was spreading into the ventromedial compartment, and they thought it might even be forming an abscess. That just shows how aggressive this condition can be.
It really does. And the fact that they found otitis internus too meant the infection had spread to the inner ear. That made the prognosis even worse. In the end, the decision to euthanize was the most humane option. It was clear that the cat was suffering, and there wasn't much more they could do at that point.
This has been such a heavy case, but it's definitely taught us a lot. We've talked about how hard it can be to diagnose these things and how challenging the treatment is, and the sad reality of bad prognosis in a case like this. But what does this all mean for other cats? What can we learn from this case? We'll talk more about that in the last part of our deep dive. So we've really gone deep into this cholesteatoma case in a cat, and it's been a tough one to process. We've talked about the diagnosis, the treatments, the really difficult decision to euthanize. Now it's time to zoom out and think about the bigger picture. What are the implications of all this?
You know, one thing that really stood out to me is how this case shows just how connected different parts of the body are. I mean, it started as an ear problem, but then it affected the nervous system, the skull, and even the inner ear.
Yeah, it's like a domino effect.
Yeah.
One problem can set off a chain reaction in other parts of the body.
Exactly. And that's why it's so important to take a holistic approach in veterinary medicine. We can't just focus on one thing. We have to look at the whole patient, their history, everything that's going on.
It really was like a puzzle in this case. The vets had to put together all these different clues to figure out what was going on.
That's a good way to put it. And one of the biggest clues was that possible connection between the ventral bulla osteotomy and the cholesteatoma.
Right, and that brings up some important questions about the long-term effects of surgery. Even when a surgery seems successful at first, there could be problems down the road.
Absolutely. We need to think carefully about follow-up care after any surgery, especially in sensitive areas like the ear.
It's a good reminder that complications can pop up even years later.
Definitely. And you know, this case really makes me think that maybe we should be doing routine follow-up imaging after ear surgeries in cats. What if they had done another CT scan a year or two after that first surgery? Maybe they could have caught the cholesteatoma early when there were more treatment options.
That's an interesting point. It definitely challenges the way we do things now and makes us think about being more proactive.
Yeah, I mean, imaging does cost money, and there are some risks. But when you think about how serious a condition like this can be, catching it early could make a huge difference. It's a conversation we need to have in veterinary medicine.
This case also shows how much we still don't know in veterinary medicine, especially with rare conditions like this one.
That's true. It's a humbling field. We're always learning, and sometimes we have to admit that we don't have all the answers. We have to be honest with pet owners about that.
Absolutely. Honesty and clear communication are so important.
It's about working together. The veterinarian, the pet owner, and of course the animal. We're all in this together.
That's right. We have to work as a team to make the best decisions even when things are uncertain.
That's one of the big takeaways from this case. Veterinary medicine isn't always about easy answers. It's about figuring out tough situations with compassion, expertise, and a willingness to keep learning.
And sometimes it's about making hard choices for the good of the animal.
This case is a perfect example of that. It makes you think about the challenges and the rewards of this profession.
Well said. I think this wraps up our deep dive into this cholesteatoma case. It's been a heavy one, but also very insightful. Any last thoughts for our listeners?
I think the most important thing to remember is to pay attention to your cat. If you notice any changes in their behavior, especially if they've had ear problems before, talk to your vet. Don't wait. Even if it seems like a small thing, early detection is so important.
Great advice. And with that from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.